Friends, this is Dr. Sanjay Pandey from the Kokilaben Dhirubhai Ambani Hospital in Mumbai. To bring about safeguarding urinary health is a priority that everybody should have. And therefore, we keep chanting this all the time that you should bring your health to the front row seat. Friends, when I get to see prostate issues in men from late 40s till 80s, I look forward to understanding that many a times it does not hit us so hard. A progressive, gradual phenomena where the prostate undergoes a change. The change that a common man across the table, across my consult table, understands as a prostate that is growing gradually, which is measured by an ultrasound, is only a anatomical characteristic that you measure. That means a prostate, a male gland, which undergoes a change, could undergo a change of uh, enlargement of the prostate from anything to 20 grams to 200 grams. And this happens not in a day, week, month, or a year, but over years or decades of change, which happens from 40s to 80s. Friends, if somebody has got a prostate issue, if somebody has got an urinary issue, where he complains of obstruction to the flow of urine, the urine is not coming out well, take a long time to pass urine, doesn't empty the bladder completely, and many a times an ultrasound finds the prostate is enlarged and the residual volumes don't are high enough and don't empty completely, and the bladder wall is getting thickened, working stronger and stronger to empty the urine. There's an obstruction to the flow of urine at the level of the prostate, which actually is blocking the urinary passage. So that's a urinary pipe, the black one which you see, and that is the prostate. So prostate is something which is just below the urinary bladder. It blocks the urinary passage gradually as a result of the change happening with age, which is translated into a growth that you see. But a small prostate also can block a urinary passage, and a large prostate may just grow and not block the urinary passage. So that's the male urinary passage which you see through which urine comes out. And if you are on medications and not doing very well, if you're not on medications and don't know anything about prostate and you're obstructed, if you are an individual who goes through a routine of infections again and again as a male, if you are bleeding in urine, you take a long time to empty urine, and you are on urinary catheter and urinary catheter is not coming out, I think I need to see you. I need to see you at the Kokilaben Dhirubhai Ambani Hospital in the Department of Urology. I need to see you when I come to Tanzania, to Dar es Salaam between 7th to 10th of March this year, approximately 2 weeks later. And want to look forward to safeguarding health on prostate to all men who belong to that region. People from Kampala, Uganda, people from Malawi, people from Mombasa and from Nairobi, people from Arusha and from Dar es Salaam, and people from all those parts of the world who have got urinary complaints are welcome to be coming to the urological care, where we would looking at identifying you, looking at the address which is mentioned down there. That is at Oyster Bay in the region of Masaki at Dar es Salaam between 7 to 10th morning till evening, seeing you for urinary complaints which are just started, which have been there for a long time, where you leak urine and cannot control urine. You are a man or a woman. You leak urine through the vagina, through the rectum. You can't control urine through the urinary passage. You have had intermittent bleeding per urine. You have had cancers of the prostate, cancers of the urinary bladder, or cancers of the kidney. You've got issues with sexuality where you've got erectile dysfunction. The erections are not good. Erections are failing. You're failing medicines on erections. Or you have got a bend in the penis, or the penis is shrinking and getting shorter, or you're losing your libido and the drive. In other words, urinary and sexual health is a domain of a urologist and a andrologist. To me, in the last 25 years in urology, it has been a treat to be able to look at safeguarding urinary health by establishing an awareness to awakening to individuals in this part of the world. And when I travel to Tanzania once in 3 months, I always look at being able to safeguard by establishing a connection, by looking at individuals who carry reports, who come with hope, who come for consult from different parts of the country and including that part of the of Africa. We look forward to you having trouble on anything which is happening to be corrected, to be rejuvenated, to be recovered, to be cured if possible by our aspects of care that we would do in terms of diagnosing and looking at uh, giving you the kind of therapies that we can give. So, friends, men suffer from prostate issues, men suffer from obstruction to the urinary flow, they suffer from stricture urethra, they suffer from sexual problems of erections and loss of libido and shrinking penis and the bent penis, or a penis which has no erections and a bend that doesn't allow them to perform. Women suffer from recurrent UTIs. Women suffer from leakage of urine when they cough, run, jump, and laugh, called incontinence of urine. Children suffer from various congenital problems, which includes the bladder growth, which includes various aspects of hypospadias and epispadias and leakages of urine, neurogenic bladders. We also look at children who bedwet every night and they are treatable and curable at the Kokilabin Hospital. As much as when I come back to Dar es Salaam to our Mumbai Healthcare Services in the region of Oyster Bay, plot 138, we'll type down the message for you to establish. Look at your bookings in advance and come and see us between 7th to 10th there. And you're welcome to Kokilabin Hospital to always come over with difficult urinary complaints which has not been treated, with primary complaints on the awareness that I continue to make it on your channel to make you aware that this is treatable and curable. So why miss out on aspects of care and cure that we can do and bring it to the best possible levels around? I look forward to establishing a connection with individuals who are suffering and they can be treated and cured. People are going through a trauma of not getting the result even after taking medicines. So if you have a prostate issue, if you have a urinary issue and you're taking medicines and the results are not great, the flow is poor, you don't empty your bladder with a good flow, you're in your age of 40s to 80s, the changes have already happened. They are going to progress. And therefore, it's important to bring your health to the front row seat. Make hay while sun shines. Establish yourself and take it forward to the highest possible level. To me, my attempt again to be coming to Dar es Salaam is to see patients from that region completely, to help out individuals who have got urinary problems, sexual problems, prostate problems, cancer issues, bleeding, leakage of urine, all kind of sexual issues which men and women go through. And these are all treatable and curable. So that you have not been treated till now or have not known about this, you should listen to me speaking on this channel where I attempt to look at awareness to the highest possible level to awaken individuals and to take them forward to the highest possible level. It is important for us to safeguard health on the urinary and sexual issues, which is completely missed out. It's missed out because we don't talk about it. There's a shame or there's a little bit of reluctance to talk about all this, but we continue to suffer. So why live a life of agony? Why live a life where things are not in shape? Because they will only progress and worsen with passing time. Each of you is welcome to come to the outpatient department at the Kokilabin Hospital to take your appointments, walk in clinic, see how we can establish a connection, see you, and take you forward to the highest possible level. Thank you for the support that you always give. Thank you for the support that you give to us, to the team urology, to the team Kokilabin Hospital. It feels good to be able to establish a connect, to be able to attempt therapies by doing a right approach to the right individual in people who deserve care. So, friends, health has to be completely safeguarded. And we look forward to seeing you back in Dar es Salaam again for 4 continuous days to be seeing any and everybody who has got urinary and sexual complaint, be it a child, be it adult, be it male, be it female, be it geriatric age group, be it treated before and failed, or be it never treated and never known. All of you are welcome. Register yourself at the Mumbai Healthcare Services in Dar es Salaam and welcome to come and probably take the best of the opportunities to get treated. Thank you so much.